Since 8 p.m. last night, we have had one additional case. This is a gentleman in his 50s who attended Myer at Bondi Junction, Westfield.
It's hopeful news for New South Wales, but nobody's resting easy just yet. Today's new case showing just how transmissible the Delta strain is.
It appears from CCTV cameras that it could have been a very fleeting contact between the infectious person and this gentleman in Bondi Junction, Westfield.
The state has so far avoided a lockdown, but masks are now mandatory on public transport, and everyone's thoughts are turning to
vaccination.
Vaccine.
But with Australia's key advisory group upping the recommended age for AstraZeneca to 60 and over, community confidence has taken another hit.
Well, our vaccination clinic was pretty empty today. We've got a large capacity. We had at least half of our patients cancelled today, and we had all the patients who are in that 50 to 60 age bracket cancelled.
It's been widely reported that the risk of a blood clot from the first dose of Astra is around 1 in 55,000. But if you've already had your first dose, the odds of getting a clot after a second jab are a much smaller 1 in 600,000.
Any of the almost 4 million people who have had the first dose of AstraZeneca should not cancel their second dose.
Despite that, more people are trying to turn to Pfizer, frustrating state leaders and those tasked with getting shots into arms.
There's been well over a year for the Commonwealth to get these matters sorted. The fact is, from today, there's going to be a public hit of confidence in terms of AstraZeneca, and we've got less Pfizer to give at a time we've got increasing demand. We are falling behind in this race.
The AstraZeneca is a very safe vaccine. However, I can still understand people's anxiety around getting it. It's a bit of a tricky situation because we do need the entire population to get immunised against COVID-19. However, we would like to do that in the safest manner possible.
Epidemiologist Professor Mary-Louise McLaws joins us now. Mary-Louise, we'll get to the AstraZeneca situation in just a minute, but you're in Sydney, where New South Wales Health are tonight investigating a potential new case on the northern beaches. Do you think the New South Wales government is doing enough to contain this Delta strain outbreak?
Lisa, we need to learn from the UK, where Delta is now 90% of all cases, and the USA are now really concerned that Delta may derail their restrictions, and they may need to go back to having restrictions and derail their vaccination program. It's highly infectious. You don't need a lot of contact. And I think it's great that we're wearing masks on public transport. We should do that all the time. But I think actually it could be time for the next couple of days to wear a mask in public when we go shopping.
Professor, with doctors now reporting that people are cancelling their AstraZeneca appointments, even some people getting their second jab, is the change in advice perhaps doing more harm than good?
I think the advice should be doing the complete opposite. In fact, it should be making people feel that they're being listened to. The government is now responding, and in fact, they've reduced the risk considerably. Those that are 60 and over have an enormous risk of death if they get COVID. Do you know that 98% of deaths occur in the 60 and over, and 94% of deaths have occurred in the 70 and over? So please, if you're 60 and over, get that second dose. You've got very, very little risk of any adverse event other than maybe a sore arm.
Mary-Louise, Health Minister Greg Hunt says that the upside here could be that 1 million over 50s who were perhaps hesitant about AstraZeneca will now be eager to sign up for the Pfizer vaccine. Has he got a point there?
I think he's got a very valid point there. I think that the 50 to 59 should now feel very cared for and listened to. You know, people talk about that group being hesitant. I don't think they ever were. They had reasonable concern, and they're the sort of people that take a long time to make really important decisions. So they should actually see that the government has responded as a really responsible response, and I think they should be really pleased now, and I can't imagine they wouldn't be rushing out trying to get a Pfizer injection.
Mary-Louise, always great to get your perspective. Thanks so much for joining us.
Stay well.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.